In this video, guys, I want to talk about benefits of pregnenolone, progesterone for PFS symptoms, okay? And mostly I would like to talk about risk and if it's really good choice to start with pregnenolone and progesterone. I will explain why, okay? So stay with me till the end, you will get a lot of knowledge, okay? So first of all, I see that many doctors are right now aware of PFS. At least they have some basic understanding that, for example, progesterone or pregnenolone are precursors to other hormones like allopregnenolone. That is really a big issue in PFS, okay? But they don't understand other things, okay? So let me tell you what are, first of all, let me tell you what are the benefits, okay? So it improves neurosteroid imbalance, okay? So like I said, PFS, low levels of allopregnenolone, then you have things like brain fog, anxiety, depression, okay? So pregnenolone can be converted into allopregnenolone, and then you have GABAergic signaling, you have relaxation, mental clarity, and so on, okay? It also enhances memory and focus, okay? You will reduce anxiety, depression, you will also balance cortisol levels, okay? So pregnenolone supports adrenal function, helping balancing cortisol, okay? You will be stress resilient, mood can improve energy. All you hear, everything is great, okay, but it's missing one thing, so stay with me. I will explain what is the missing thing here, okay? So it can also support androgen production, okay? So because pregnenolone is precursor to DHEA, testosterone, okay, indirectly supports DHT synthesis, okay, and improves GABA and dopamine interaction, okay? Progesterone, okay, progesterone is directly converted into allopregnenolone via enzyme 5-alpha reductase. Okay, this is the most immediate precursor in the pathway, okay? So benefits supports GABAergic activity through allopregnenolone production, promotes relaxation, reduce anxiety, and help with sleep, guys, okay? So stay with me, okay? So potential risk, okay? So hormonal imbalances at high doses, okay? I see many doctors, they are prescribing really high doses of progesterone and pregnenolone, okay? So for example, like pregnenolone, okay, low dose tend to be calming, but higher dose can cause irritability, okay, can be too much stimulating, okay? So, and also long-term use, and no doctor will tell you, you can suppress the body own production of pregnenolone, okay? So if not cycled properly, okay, guys, okay? Also, who should be cautious with pregnenolone? Individual with high cortisol, for example, and hormone sensitive individuals, like if you have estrogenic dominance, it can be also because of your high serotonin and so on, okay? But let's move further. Why supplementing with pregnenolone or progesterone can be risky, okay? Because in PFS, 5-alpha reductase enzyme is impaired, okay? So the activity, you need 5-alpha reductase activity, okay? So think about it, okay? So it's not like proviron, okay? Proviron, you will start proviron, or you will put DHT cream on your penile shaft, and it's directly DHT. You don't need 5-alpha reductase, okay? But for pregnenolone and progesterone, it will not work without 5-alpha reductase. If 5-alpha reductase activity is reduced or impaired, okay, as will mostly happen in post-finasteride syndrome, otherwise you will not have a problem with allopregnenolone or with DHT in your penile tissue, okay? So supplementing with pregnenolone or progesterone can lead to unintended hormonal imbalance, okay? So because, like I said, you need 5-alpha reductase in order to convert even pregnenolone to this enzyme convert progesterone to allopregnenolone, testosterone to DHT, okay? And what happens, you can really boost estrogen and cortisol pathways, okay? So you will really spike cortisol, you will really spike estrogen, okay? You will make hormonal pathway shift to estradiol because of the reduced 5-alpha reductase activity, okay? So, and this will lead to symptoms like gynecomastia, water retention, fatigue, worsen of libido, erectile dysfunction, okay? So that's the main problem I see, okay? So also you will have higher cortisol pathway, okay? So you will produce much higher cortisol level, and this will also lead to increased anxiety, insomnia, fatigue, even muscle breakdown, guys, okay? So too much cortisol without 5-alpha reductase. Why some PFS guys are losing muscle? Okay, so catabolic effect is due to high cortisol levels, okay? So and you will get no neurosteroid benefits. You will see no increase in allopregnenolone, okay? So without proper 5-alpha reductase activity, allopregnenolone synthesis may not increase, meaning the many of the mood and cognitive benefits won't happen, okay? So like I said, it's symptoms. I will tell you also the symptoms you might experience is with pregnenolone or progesterone in 5-alpha reductase deficiency, okay? So you can have worsening of estrogenic symptoms, okay? Water retention, mood swings, irritability, gynecomastia, okay? Then you have elevated cortisol, increased stress response, okay? Fatigue or burnout, sleep disturbances, okay? So it's not good, okay? And I see many times that the doctors and other coaches, they just add progesterone or pregnenolone, guys. 5-alpha reductase activity. That's the main focus in PFS, okay? So finasteride is blocking predominantly 5-alpha reductase 2, but also 5-alpha reductase 1 to some extent. We don't know to what extent it is blocked, okay, guys? So the most important thing is, I always tell it, 5-alpha reductase enzyme. This is the mighty enzyme we need to fix. IGF-1 support, zinc, and all the other herbs and supplement that can really boost 5-alpha reductase activity. Also, you need to avoid 5-alpha reductase inhibitors, green tea extract, quercetin, curcumin in high doses, because even ginger, because all of these can block 5-alpha reductase, okay? So you can use DHT therapy, okay? So, and of course, if you have already some imbalance, you need to address estrogen imbalance, okay? So aromatase inhibitors, also DHT is light estradiol blocker, okay? So guys, if you want more videos, let me know, and let me know what you think as always. Bye.